This is At Home with ADTS, a show that presents topics of interest to older adults, individuals with disabilities, and their caregivers. At Home highlights the services and programs offered by Aging, Disability, and Transit Services of Rockingham County.
Welcome to this edition of At Home with ADTS, a program about supports and services offered by Aging, Disability, and Transit Services of Rockingham County. I'm Ashley Cooper, Director of Community Outreach and Development. ADTS has been in operation in Rockingham County since 1973. Our goal is to assist and link senior adults, people with disabilities, and their families with information, opportunities, and services that promote and enhance quality of life, as well as working to meet the local transportation needs of Rockingham County residents. We would like to take a moment to thank our United Way of Rockingham County partner for their long time and generous support for our Meals on Wheels program. United Way of Rockingham County brings together local people to help raise local dollars to meet local needs. And we are very appreciative for everyone who's contributed over the years. Today, we're going to be joined by Jeanne Slayton with Hospice of Rockingham County. But before we dive in, I just wanted to share that caregiving for someone with a serious illness can be really overwhelming. And sometimes it's hard to ask for help or even know what the options are. In today's episode, we're going to explore the new support in our area offered through Hospice of Rockingham County called Serious Illness Care. Our guest today is Jeanne Slayton. She is a care consultant with Hospice of Rockingham County. Hi, Jeanne.
Hello, Ashley.
Thank you so much for joining us and taking some time to share this wonderful new resource in our community.
Well, thank you for having me.
Sure. Well, before we dive in, can you tell us a little bit about yourself and your role at Hospice?
Sure. So my name is Jeanne Slayton. I've been with Hospice of Rockingham County for nearly 3 years, but I've been in the healthcare world, so to speak, for one of my older sons is 28, so 28 years, with a lot of experience in older adults and their needs. So with Hospice of Rockingham County, I'm the care consultant, which is kind of a fancy name for community liaison. So I work to educate the healthcare providers, their staff, and community all about the services and the support that Hospice of Rockingham County provides.
Wonderful. So what exactly is serious illness care and its goal?
Serious Illness Care is a fantastic new service from Hospice of Rockingham County. It's known by some as palliative care. We've chosen to call it serious illness care so that everyone is very clear on the difference between serious illness care and traditional hospice care. Serious illness care is a program that's available for anyone who has any serious illness. So COPD or congestive heart failure, cancer, any of those things. And it's designed to help manage symptoms, help support the patient and their families with resources, access to our social workers and our chaplains, disease education, to better improve your quality of life at any stage of illness.
Wonderful. So how is it, though, different from hospice care?
So serious illness care is actually available at any time during the course of your illness. Preferably, we would love to have folks come on to our serious illness care earlier. So when they're first diagnosed with their serious illness, when they get that cancer diagnosis right at the very beginning, or they find out they have COPD or congestive heart failure, you can receive serious illness care and the support from our nurse practitioners and our care team and our physicians, along with your physicians at any point in time. Hospice care is slightly different. While it's still a comprehensive care and we work with your physicians and your family and all of that, hospice care is designed to support those that are in the last 6 months of their serious illness and are no longer seeking aggressive treatment for it.
Okay. So we know it supports people who have a serious illness. How does it support, or does it support caregivers?
Absolutely. So not only do we spend time working with patients and managing their symptoms and helping them have better outcomes, all of that, we also help support caregivers with education about what that disease looks like for that patient, what struggles they may have, and other resources that they can help. But a lot of what we do too is linking the caregivers and their patients with community resources. Oftentimes, there's needs for transportation. Maybe there's some additional caregiving support or food insecurity. That's a big one that a lot of folks in our community face. So our social workers work with our families to help them find resources for that. The other thing that our social workers do an excellent job is working with families on healthcare power of attorneys and living wills and all of those kinds of things that no one really thinks about until you need them, which makes it more difficult to get it done. So our social workers will work with families on what does this look like? Let's have a conversation about what your goals of care are and what do you need to successfully meet those goals of care. And how can we help support you or find the resources that are available in the community to help support you?
Sure, that sounds wonderful. Anytime you can connect people to other resources, I think a lot of time in our community, and not just in Rockingham County, in most communities, people aren't aware of resources and services outside of what they're needing at that moment. So it's great anytime that we have partners who want to link people to other resources as well.
Absolutely.
So, I know we talked about, so let me just give you an example. My mom has COPD.
Mhm.
She's managing it pretty well, through inhalers and things like that. Now, if her care takes a little bit more of a turn where maybe it might be time to transition her to oxygen, is that when I should reach out to you guys for this support, or as soon as we get the diagnosis, or any time in between?
So the correct answer is all of the above. We're always available for anyone at any point in time. But ideally, with a serious illness care program, it would be when you get the diagnosis. Now, I'm assuming your mom's had COPD for a while. So she's had the diagnosis, but she can certainly benefit, and you can benefit from the support as well. Now, it helps folks with education. It helps folks, again, hook up with community resources on the caregiving side of it. But more importantly, we also help that patient with the education and support and management of symptoms. So we'd also like to see if we can help keep you out of the hospital, reduce the need for those emergency visits. So if you're on our serious illness care program and our nurse practitioner is visiting with you, and you've noticed that this triggers your exacerbation or whatever, then our nurse practitioners can work with you on how to avoid that trigger, or how can we pre-medicate for that trigger, or whatever that looks like, right? So that you avoid that exacerbation before you end up in the hospital.
Well, that's a good point. That's a good point. Anytime I can save money from her going to the hospital, I'm always happy for that.
And stay out of the emergency room.
Yes,
Right?
exactly.
With COVID, we've tried to encourage folks to stay out of the emergency room as a general population, right? Well, that still continues, even though our COVID numbers in this county at least are lower than in some other counties. But it's still out there, right? And there's other diseases that you can pick up in the emergency room. If you have COPD, congestive heart failure, cancer, you're at higher risk for those opportunistic infections anyways. So if we can avoid having you have to make that trip to the emergency room and keep you healthier, then your outcomes are better, right?
Yeah,
So,
absolutely. Absolutely. I would also say that sometimes there are times when it's kind of hard for her to get into the doctor's office.
correct.
So as soon as she starts getting a little bit cold, a cold or a cough that's associated with it, I'm on her immediately. Like, how long have you had this cough? Is it getting deeper? Because she's really prone to pneumonia if we're not careful. So, if she was part of this program, would I then just call the nurse who's supporting or overseeing us and say, I'm a little concerned. Can you come check her out? That kind of stuff.
Absolutely. Our nurse practitioners will always come and do their very first appointment in the home of the patient. And that's a much longer appointment, right? So we do a head-to-toe assessment and talk about what the needs are and all of those kinds of things. And then our follow-up visits with our nurse practitioners are driven by patient needs. So you may not need to see us but every 6 weeks, but you may need to see us more often than that. You can reach out. We can come to your home. We also have a serious illness clinic that's located in Eden, and patients can actually schedule their appointment for follow-ups there as well and see our nurse practitioners. We have 2 fantastic nurse practitioners that oversee that program, Kim Burkhart and Rhonda Lucas, and they do a fantastic job of working with our serious illness care patients.
Oh, wonderful. That's good to know. So as a caregiver, I decide to reach out. Is there any information I need to have prepared before I give you guys a call?
Absolutely not, honestly. Anybody can call us at any point in time and say, this is what I need, this is how I need it, this is what's going on, and we'll hook you up with the right program. We can do all the work on the back end. Serious illness care and hospice care actually require some things from your primary care physician in order for us to serve you. Just like any other service, we have to have an order. So even if you're getting home health, you have to have the order for home health, right? Same thing, but we can do the work on the back end of that to get that order, to communicate with your physicians and all of that kind of stuff. Some providers send in referrals to us, but a lot of times it's the family that calls us as well and says, hey, this is what's going on. I need some help. Can you help me? So we can help with that.
Wonderful. So is there a cost associated with this?
So serious illness care is actually covered by almost all insurance plans. So Medicare, Medicaid, the VA covers it. So does commercial insurances as well. But it's viewed a little bit differently than hospice in that it is viewed as a specialty clinic kind of a thing. So if you think about, I'm sure, back to your mom, she has a pulmonologist. When she sees her pulmonologist, she may have a copay that's a little bit higher than when she sees her PCP. That's the same that it is with the serious illness care program. That's one of the ways that we also differ from our hospice services as well. So there is a copay associated with most insurances in their coverage with palliative care, but we do the work on determining what that is, and we contact the insurance company and get all the prior approvals. So we'll let you know that information up front as well.
Okay, wonderful. Is there anything else that you think in general that we should know about this program that I haven't asked you about? You've done such a fantastic job of sharing.
Honestly, if I can say anything, it is call us. Call us. If you or a loved one are diagnosed with or facing a serious illness, call us. Let us help you. If we can't or you aren't comfortable with it, then we can give you some other resources perhaps, but give us the opportunity to help support you. You don't have to do this by yourself, and you shouldn't have to do it by yourself.
Mm-hmm. Absolutely. I see that we have some information. Where can I find additional information about this program?
So you can go on our website at any point in time. There's information on there about both hospice and our serious illness care. If you have questions, though, sometimes I think it's best just to go straight to the source and ask them. I would encourage you to call our serious illness care office. That number is 336-635-9031. And talk to Stephanie, is the serious illness care programs intake coordinator. That's a mouthful. And she'll answer them. Of course, you can also call our main office at 336-427-9022. And just about anybody there can answer any of your questions and get you directed in the right way.
Okay, wonderful. Thank you so much, Jeanne. I really appreciate it. I can't speak enough about this service. I know people who've used it, and it's really helped. I think a lot of times when people are facing serious illnesses, they feel just alone, like they're the only ones going through it. And to know that there's a resource that's available for them, whose goal is to help them be as comfortable and to manage their symptoms, and to know that you can call somebody when you have an issue and know that you're going to get a great response. So you're getting the great customer service that you get with hospice. I think y'all have amazing service. at the same time that you're getting supportive care long before you're at the final end of life. So, it seems like a no-brainer to me. So I appreciate you taking the time.
Me too. Thank you very much for giving me the opportunity. And again, if I can reiterate, if you're a caregiver, if you're a patient, if you're a family member, please reach out. There's so many resources in our county, and not just with Hospice of Rockingham County, but with ADTS and with all of the folks that are here. No one should have to deal with anything by themselves. There's always somebody here that can help point you in the right direction or help support you. So please feel free to reach out.
Absolutely. If somebody would like for you to come and share to their faith group or their service club, how can they reach you?
The best way to reach me is actually to call our main number. So again, that's 336-427-9022 and ask for me, Jeanne Slayton. If I'm not in the office, they'll send you to my voicemail or my cell number, and I'm happy to present. I'm happy to come and talk. I love educating folks on what's out there and how we can help support you.
Wonderful. Thank you very much.
Oh, thank you.
Sure. And so that's all the time that we have for today. We thank you for watching and hope you found this information beneficial. For more information on the programs and services offered through ADTS, you can visit our website, which is www.adtsrc.org, or you can always give us a call at 336-349-2343. We thank you again for joining us today, and remember that ADTS is here to help you and your family to age with dignity and independence in your home and community. Thank you.
Thanks for tuning in to At Home with ADTS. For over 45 years, Aging, Disability, and Transit Services of Rockingham County has focused on enhancing quality of life for individuals by empowering them to achieve optimum health and well-being, independence, and participation in community. To learn more about community-based services, resources, or how to help, visit adtsrc.org or call 336-349-2343.